Could you press the button to get, there you go.
4 days ago, my granddaughter, who is African American, had my first great-grandson, my first great-grandchild. I have 4 African American granddaughters. I have been aware for a period of time of the disparity between the good health of the mother and baby of African American mothers and babies. This is caused me a bit of panic when my first and oldest granddaughter was pregnant. She was dying to be pregnant, and she would be a marvelous mother, and she is that. But I knew that she needed extra support because I had been reading about this terrible disparity. And one of the main solutions for this disparity in anything that I have read is the support by a doula. And I was fortunate enough to have that access to be able to provide that access for her. I feel that it's essential that every woman have a person like that if she so chooses, whether she can afford it or not. I do believe that you've been hearing from these other 4 people who have borne witness some of the statistics. I am not a statistic kind of person. I speak from my heart and from my personal experience as a woman who was supported during childbirth and would not have had the kind of birth I had if I had not had that support. And that was in the 60s, sir. And I feel that we spend far too much money on technology and expert care that is really useful for a cesarean section, because obstetricians are, surgeons, and they are important, and I do so appreciate that we had a representation from an obstetrician here, from a nurse who works at Women and Infants Hospital in the maternal and child health, from a midwife, which we fought for many years here in Rhode Island to be sure that there would be that kind of care. Now it's time to recognize that these other professionals are not able to give the kind of support that can make the difference during pregnancy, throughout the whole labor, and then into the postpartum period. What frightens me now, not that much, because she still has her doula, is that even in the postpartum period, the statistics are quite frightening for African American mothers, and we had one of those mothers here today. So the testimony has to be, you have to hear this testimony. And this is not something to be taken lightly, and we need to rectify these distinctions.